Hi, everyone. Thanks so much for joining our Building Evidence RFP webinar. We're very excited that you're all here, and we'll start in a minute. We'll give folks a chance to join, so hopefully no one's in the waiting room, but we'll start soon. Okay, we do want to be respectful of everyone's time, so let's jump in. We're very happy to have a full crowd here today, and we know you have a lot of competing demands, so thrilled that so many of you were able to join. As a quick introduction, I'm Shrutika Sabharwal. I'm a director on the evidence and evaluation team at Arnold Ventures, and I'm joined by my colleagues from across different AV policy teams, higher education, career pathways, health, and strategic initiatives. And I let them introduce themselves as they present on their research priorities. And I'm also joined by my colleagues Carlos and Elaine, who are managing operations on the back end and helping us run the webinar. So we're really excited about our recently released RFP. So we've been eager to share more information today with everyone here. And last week, we hosted a more general interest webinar that was meant to provide an overview of both the RFPs as well as spotlight, in particular, the infrastructure and public finance teams. And the recording and password for that can be found in the chat. Elaine just shared it. So we hope if you're more interested in the sort of overarching goals of the RFPs and what we look for, then would encourage you to listen to that recording. Now, today's webinar will be a deeper dive into the Building Evidence RFP, which is one of the two RFPs we launched. And this one supports quasi-experimental studies in particular and is limited to select strategic policy areas. So we have two main goals for the webinar today. The first is to do a very quick overview of what this particular RFP, the Building Evidence RFP, is about, and help you think broadly about how your research can best align with this funding opportunity. And then the second is we want to spotlight 5 of our policy priority areas, as I mentioned. So you'll be hearing directly from team members representing higher education, career pathways, healthcare broadly, as well as Medicaid specifically, and online gambling. And we'll try to be efficient in this presentation. So we'll do a quick introduction on Arnold Ventures as well as RFP, short presentations from each of the policy teams to spotlight their research priorities, and then a little bit of guidance as you prepare your applications. And finally, we'll wrap up with a live Q&A session. So at any point during the webinar, please feel free to submit your questions in the Q&A window. Because we get a high volume of questions, we generally pick broader questions or respond to broader questions rather than those very specific to your particular letter of interest. And as you can imagine, we're not able to provide individualized feedback on the webinar. Last note before we begin, the webinar is being recorded, and we'll share a recording of this with everyone that's registered in the next few days. Next slide, please. So starting with a quick overview of Arnold Ventures, Arnold Ventures is a philanthropy that invests in high quality causal research, really with the goal of generating evidence-based solutions to some of the most pressing problems we face today. And we work in a wide range of domestic social policy areas, including criminal justice, healthcare, higher education, public finance, infrastructure, etc. And within AV, next slide, please, we're the evidence and evaluation team, which has launched these two RFPs and manages them. And we operate across all policy areas. We're really guided by two main goals. The first is to build the body of rigorous evidence about what works. The focus is really on generating new evidence that can be used to inform current and future policy decisions. And that is the key goal of the RFPs as well that we're discussing today. And the second goal our team has is to support the use of existing evidence in guiding better and more informed and evidence-based policy decisions. So really our goal ultimately is to be able to use rigorous causal evidence to improve outcomes for children, for families, and for communities across the country. Next slide, please. So turning to why many of you are here are RFPs. As some of you may remember, we launched these two RFPs earlier in this year, and we're very excited to relaunch them. We were thrilled by the response we received, and we want to continue supporting strong research projects this year as well. So as you can see from their titles as well, the first one is the Strengthening Evidence RFP, which exclusively supports randomized control trials across most social policy areas. And the Building Evidence RFP focuses on quasi-experimental studies in specific policy areas. So again, our session today will focus specifically on the Building Evidence RFP, but if you want to learn more broadly about our RFPs and the selection criteria, Elaine's dropped a link to the recording of the past webinar. Next slide, please. I also want to take a moment here to call out on some of the key highlights in this round of the RFP, some of which will be familiar if you've seen our RFPs in the past. One is we continue to require LOIs to be submitted using our template, which we have developed to increase efficiency as well as clarity in drafting the LOIs and a review of them. This template will be available in our RFP, so please use that as you're drafting your letter of interest. It includes two parts. The first is a one-page key study detail section, and then the second page is a typical three-page letter of interest. Just a quick logistics note, some browsers automatically download the template when you click the link instead of opening it. So if you don't see anything happening, please check your downloads folder. It might be getting saved there. Second thing I'd like to point out is that we have expanded our frequently asked questions section, and there's a link again in our RFPs, as well as Elaine might have posted that in chat. And we've sort of refreshed this from the last round to make it more expansive, as well as address a lot of questions that we've been receiving over time. And the third thing I'd like to point out is that we've updated our policy priority areas as well as research priorities within the Building Evidence RFP. So we've added new policy areas as well as really tried to align and streamline the existing areas with what our priorities are. Next slide, please. So a quick overview of what we look for in the Building Evidence RFP. There are three major features we look for in a strong LOI. The first is that the study must use a strong causal quasi-experimental design. So rigor is our North Star. We're looking for well-specified, adequately powered, and methodologically strong studies that demonstrate rigor and feasibility. So in the LOIs, we want to see clear articulation of what research questions you're addressing and how you will answer them. So for example, what program or policy specifically are you evaluating, and what are the exact outcomes? Sorry. What method will you use and why is it the right one? What is your treatment and comparison group? What are the threats to validity and how are you dealing with them? So these are some of the things our reviewers look for in the LOIs. Also a note that examples of eligible methods under this RFP include difference in differences, regression discontinuity, instrumental variable designs. And this is not an exhaustive list, but these are typically the methods that continue to move forward in our RFP process. If your study uses a randomization method based on a lottery or oversubscription, I'd encourage you to submit it under the Strengthening Evidence RFP that looks at studies that leverage randomization. One thing to note is that the only commonly used quasi-experimental design that we do not support typically is a matching study, including propensity score matching, unless it's paired with another eligible design. So if your study relies only on matching, it will not be eligible under this RFP. All right, the second criteria we look for is that the study must be policy relevant. So we prioritize research that has a pathway to informing policy or practice. So whether that's helping scale an effective program or shaping funding decisions or informing public agencies or new policies or regulations. So strong LOIs will discuss why a particular problem you're trying to address matters, who stands to benefit, and how results from the study can inform that change. Finally, as I've been mentioning, the research topic must be aligned with one of the strategic priority areas listed in the RFP, and not just the broader area, but also the specific research questions or the specific outcomes within it. So the policy areas are listed at the bottom of the slide that are eligible for this round of RFP. So that includes higher education, career pathways, healthcare, Medicaid, online gambling, infrastructure, and public finance. As I mentioned, we heard from the infrastructure and public finance teams last week, and we'll be hearing from the remaining teams today. So with that, let's hear directly from our policy teams. We'll start with Jessica Takeda from our higher education team, and I'll pass it to her.
Awesome. Thanks so much, Shrutaka. Good afternoon, everyone, slash morning for some folks. As Shrutaka mentioned, I'm Jessica Takeda, and I am the Director and Chief of Staff here at Arnold Ventures. And I'm going to use this time to provide insight into higher ed teams' general interests and give a little more context on the questions and projects that will particularly be compelling to us. Next slide, please. Oh, just kidding, we're on it. So at a high level, our higher ed work is focused on identifying and scaling policies, programs, and practices that improve student success and increase the value of degree, ultimately with the goal of improving ROI for both students and taxpayers. Our portfolio is focused on completion, but just as importantly on what happens after students cross the finish line. For instance, are they earning credentials that translate into strong labor market outcomes? Are they able to repay their loans? And are public investments flowing toward programs and institutions that produce strong outcomes? For this reason, we're especially interested in research that can help policymakers make real decisions about how they allocate resources, structure incentives, and hold institutions and programs accountable for outcomes. Next slide. All right, so this slide gives examples of questions we're particularly interested in, but by no means is this an exhaustive list. As you'll notice, one major area is accountability and how states and the federal government use funding and other incentives to drive better outcomes, including outcomes-based funding and academic program and approval and renewal policies. We're also interested in return on major public investment in higher ed. So think things like Pell Grants, student loans, and institutional funding, and their effects not just on completion, but employment earnings and taxpayer ROI. And a third area is price predictability. Whether policies like tuition guarantees, freezes, or other multi-year pricing commitments actually impact student behavior and outcome. So again, this isn't like an exhaustive list. These are just areas and policy questions where we think additional evidence could be particularly valuable. Next slide. And finally, I just wanted to highlight a few things that will make a project stand out to us. First is policy relevance and timing. Shrutaka already alluded to this, but just to double down, we're looking for research tied to real decision policymakers are making, where we see a credible pathway for the findings to influence policy and practice at scale. Second, where possible, we want projects to look beyond short-term measures. Completion is important, but we're particularly interested in longer-term outcomes like earnings, employment, debt, and loan repayment, ideally using strong administrative data. And finally, we want the findings to be useful beyond the individual institution or state being evaluated. The strongest projects will help policymakers understand which investments are working and generate lessons that can inform both state and federal policy more broadly. So those are the main things I'd encourage y'all to reflect on as you put together potential LOIs. Thank you. And I will go ahead, Shrutaka.
Oh, thanks so much, Jessica. Appreciate it. I'll call on Jeremy Evans now, who leads our career pathways work, to discuss that area.
All right. Good to see you all. I'm Jeremy Evans, VP for Career Pathways. You will hear some similar themes here, but with a slightly different sort of policy area orientation. So if we go to the next slide, the Career Pathways Initiative is also part of AV's education department. We are the portfolio that focuses on identifying, expanding policies and generalizable practices that improve economic mobility, and with a particular focus on pathways other than a traditional college degree. We tend to focus, we do both secondary and sort of post-secondary workforce training, tend to focus a little bit high school and up, and certainly recognize and agree with the idea that, in particular, secondary career-connected learning is entirely consistent with pursuing a college degree. And we do care about those post-secondary educational outcomes. We are on the margin, particularly focused on students and workers who don't have and aren't pursuing a traditional college degree. Next slide, please. So we define career pathways as, educational courses, training programs, various models that are really focused on that career training and career access. This isn't sort of a perfect framework per se, but we often think of our work in the three buckets here of supporting and scaling high quality career and technical education, again, both secondary and post-secondary. Ensuring outcomes-focused apprenticeships and work-based learning policies. So we look at both apprenticeships as well as other on-the-job training models, but we're really focused on scaling the outcomes, not just the participation in them. And then reforming the workforce system. So the Workforce Innovation and Opportunity Act, or WIOA system, and all the other kind of scattered workforce funding streams that operate alongside it. So there are a few example questions of particular interest here. I will also put in chat, we have thrown a somewhat longer research agenda up on the AV website, so feel free to consult that as well. But this gives you a little bit of sense of some of the things that are especially salient for us right now. There's, for those who are in this space, there's of course a lot of discussion and policy right now around quote unquote industry recognized credentials or CTE credentials that students are earning in high school. And we're interested in understanding the different guardrails, incentive structures, standards, et cetera, around them. What does that do to the credential students attain and what the longer term outcomes are? Work-based learning is this big, broad term that is used all over the education space right now and kind of means something a little different to everyone. So we're trying to get more concrete on what sort of actually delivers value, again, especially for students who may not be pursuing a traditional post-secondary pathway. How does that vary by dosage, the type of work-based learning, and in particular, policies to encourage work-based learning? What outcomes do those have? Interested in basically everything around apprenticeship. So pre-apprenticeship, youth apprenticeship, apprenticeship degree. Do these programs deliver causal impact on student outcomes, or are they mostly selecting in students and workers who might be best poised to achieve those outcomes anyway? And what do policies around apprenticeships, how they're funded, the registration standards, as those are changed, what does that do to outcomes? And as I said, we're interested in a sort of a broader set of on-the-job training policies, and we've seen some interesting sort of matching design studies of a more flexible set of what are variously called customized job training, employer-driven training incentives that are showing some signs of impact, but would like to see more causal study on some of those subsidies. Again, that is not exhaustive. There's a lot more that's on the link that's in the chat. I think there's one more slide, if I'm not mistaken. So this is, again, going to be reaffirming much of what has been said already, but looking particularly at the letters of interest we've received for career pathways focused studies over the last 3 or 4 rounds. I think we have a number of great studies going, and I wanted to highlight some things that really stood out in those LOIs, and a lot of other really interesting proposals on super interesting questions. But also some trends in things that were kind of holding them up from being able to move forward. So I just wanted to really underscore a few of those. You've heard a number of times about the policy relevant evidence piece, and I think this is especially important if you're thinking about an LOI for a particular program or school or model. We are primarily a policy-oriented, not programs-oriented organization, and so we are open to QEDs on particular programs or models, but you really got to make a case for what a policymaker who doesn't want to just fund that one exact school can do with positive findings. Is this, for instance, the first of its kind causal evidence on a particular model that's getting a lot of policy discussion, or something like that? But really speaking to the policy relevance is important. Longitudinal outcomes, as I said, labor market outcomes, especially earnings where possible, are most preferred. And then in some of the sub-bullets here, some of this may seem self-evident, but we do see a range in how concrete the LOIs are. It doesn't need to be a lot of text. In fact, really short, but really concrete. This is the one or two key research questions, the very specific outcomes, the causal identification strategy, the data we're going to use, quick hits that are really specific on that front is what's most valuable. Of course, having a control or comparison group for the quasi-experimental design is key. We do get, or we have gotten, I should say, a fair number of difference proposals or LOIs that don't speak to what the comparison group is, and that's crucial for being able to have a valid diff and diff design. So make sure you speak to that. With CTE programs and pathways, we of course realize that they're often embedded within a school that does a lot of other things, and so it can be difficult to tease out is the impact that we're seeing something about the school where a program is offered, or is it the CTE program itself? Again, not always possible to tease those out from each other, but showing some that you've thought about it and are looking for ways to tease out the impacts of a CTE specific program or policy is really valuable. And then just really reaffirming here to speak to the cogent case for how findings can be used in policy. So I'll leave it there and hand it back to Shrutika. I'm happy to answer any questions when we get there.
Thanks, Jeremy. Really appreciate it. I'm now going to call on Jillian Tisdale to cover both cross-cutting health as well as Medicaid specifically.
Thanks, Shrutika, and thanks for having me. Hi, everyone. My name is Jillian Tisdale. I'm a manager on our Medicaid and state policy engagement portfolio, which sits on our healthcare team. And as Shrutika said, I'm going to be talking about two different sets of questions, one around cross-market healthcare efficiency, which we'll start with, and the second set around Medicaid. Next slide, please. So this is actually our first time including broad cross-market healthcare questions in the RFP. We're really excited to have them included. As you can see on this slide, the boxes on the right-hand side represent our different portfolios. So we work in a lot of spaces, and so far we've had one around Medicaid, one RFP. And this really provides an opportunity to look at how some of these different portfolios and markets interact with each other. Our team, the healthcare team at AV, is really centered around the idea that healthcare in the United States is more expensive than peer nations, and we don't experience the outcomes that are commensurate to that level of investment. We recognize there's a lot of fragmentation in our market that is quite unique to the US healthcare market. There are opportunities for market failures to introduce themselves, which can drive up costs, drive down efficiency, and ultimately worsen outcomes. And our work across markets really focuses on improving affordability. And we think about affordability both in terms of how much the government is paying. So, when you think about publicly paid for programs like Medicare and Medicaid, as well as how much consumers are ultimately paying the providers and even through their employers, how much ultimately is being borne by consumers in terms of healthcare costs. Like I said, we look at these questions across a number of healthcare portfolios, including drug pricing, commercial sector prices, Medicare, provider payment incentives, Medicaid, and FDA accountability. And this is, as I said, the first time that we are looking at these markets holistically within this RFP process, looking at what is driving administrative costs when you take into account all of these different systems and who bears the burden of those administrative costs. And what are the costs of coverage churn when someone moves between one system or another, and what policies are effective at reducing that churn? Next slide, please. So diving into administrative costs and burden a little deeper, we're looking to understand how market structures and market redundancies influence administrative cost burden. I have a number of different examples, as I think Jess said earlier for her section. This is not exhaustive by any means, but to illustrate the point that we're looking for here, you might ask questions such as, how much do we spend on administrative costs across all of these systems? How do the costs of program administration vary by maybe payer segment, Medicare, Medicaid, commercial, that sort of thing, or plan type, HMO, PPO? What is the impact of adding an additional insurer on the administrative burden that providers bear? How do different policies surrounding how insurers are paid influence how much those same insurers actually spend on administration? So thinking about policies like MLRs. And when administrative costs increase, does that cut into profits? Does that drive up total spending? Does that impact beneficiary access? What is the actual cost of administration? Turning to coverage churn, we're looking to understand what is the impact when someone churns either in and out of being insured, so between uninsurance and some form of insurance, or between different systems of coverage, and what policies are effective to minimize this churn. Again, not an exhaustive list, but some examples are how much does churn drive up system costs, either by using avoidable last resort expenditures like ER visits, by disease progression that is allowed through churn that otherwise could be mitigated, or administrative spending again. What is the the cause of coverage churn across markets? And is this really due to the policy design of who qualifies into different markets, or is it due to the implementation of those policies? How much of the churn is really substantive versus procedural? And when someone churns between systems, what are the impacts on total expenditure and what are the impacts on the individual? As I said earlier, we're really looking for government expenditures and or consumer affordability, understanding that who nominally bears a particular cost might not be the ultimate bearer of that cost. And this is really an opportunity for us to examine across markets. So ideally, we're looking for proposals that include multiple markets or cross-market dynamics as people shift in and out of different insurance settings. But we're also open to proposals that consider implications from one market to another market, understanding the differences between those markets and taking that into account appropriately. Okay, now I'm going to turn over to Medicaid. Next slide, please. So like I said, this is actually our second RFP on Medicaid. Sorry, could you do the next slide? Thanks. And I really want to thank everyone who applied during our March submission. It's really interesting to read. So similarly to our healthcare team writ large, the Medicaid portfolio focuses on addressing market failures, policy failures within the program to see how the system can become more financially and administratively efficient. I saw a question in the chat that was around how we balance outcomes and costs. We'll talk a little bit more about this in the specific questions, but at a high level, this is really tied to what I said about cross-market healthcare questions. We spend too much in the system for the outcomes that we receive. So generally, we're looking to make the system more financially or administratively efficient and either holding outcomes constant or improving outcomes in that process. So certainly when you're looking at an area where some policy is changing in a way that could influence outcomes, we want to have that be an outcome of interest to determine if they are actually being influenced as you're reducing costs or reducing administrative burden. Again, here our focus is on government spending, understanding that Medicaid generally pays first dollar coverage, but where consumer affordability, beneficiary affordability is appropriate, we would factor that in as well. And in this RFP, we are including some questions from last time, also some new questions. So on our next slide, I'll talk more about that. So our first bucket of questions is looking at health-related social needs. And we're really looking to understand where covering health-related social needs, specifically using Medicaid dollars, offsets the program expenditure that is spent on providing those HRSN. This is an area where I think projects are probably going to be quite granular, looking at what specific populations and circumstances is providing HRSN effective. We really want to isolate the policy design that makes it effective for that, essentially the marginal beneficiary for whom it's effective. And successful proposals here, I expect, will be very specific in how they parse out different types of HRSN, understanding they often roll out together. So we want to, for instance, separate nutrition supports from housing, from care coordination, and ideally within those, what populations are receiving each support. So really driving into what are the circumstances that yield savings in this setting. We could also look at what policies have actually been effective at reaching the people who need those services and what policies are effective at reaching specifically the cost-effective populations for HRSN. Now, the second bucket that we're looking at here is a little bit of a repeat from last time. We did tweak the questions a bit. We're looking at how Medicaid pays for uncompensated care and the efficiency or inefficiency in that. So Medicaid, as we know, pays for uncompensated care directly through programs like DISH or supplemental payments. But there are also other programs like Medicare, for instance, that pay for uncompensated care as well. They have their own DISH program. And there are other programs that are available to people who are uninsured or underinsured, like FQHCs. So this set of questions is really to understand where there could be more efficiency if we were to align the policies within Medicaid or across ways that we fund uncompensated care. So questions might answer that projects here might answer are: where is there redundancy between payment programs, either within Medicaid itself or between Medicaid and other governmental programs? Are these programs well targeted? Is the amount that we spend on uncompensated care enough, too much? Is it well distributed, poorly distributed? How should we actually define uncompensated care, and does that definition vary across government programs? And then lastly, Medicaid pays for what would otherwise be uncompensated care. Well, it pays for uncompensated care directly through things like DISH, and it also pays for people who would otherwise be uninsured by actually providing coverage to those folks. So, in what circumstances would expanding Medicaid to particular populations or services be actually more efficient than simply providing uncompensated care for those services? Again, all programs here should be focused on Medicaid program expenditure, but can also look at other forms of government expenditure. For example, on health-related social needs, that might be where the government is already paying for example, nutritional supports through the SNAP program. On uncompensated care, certainly looking across different forms of government payments for that care. And as my colleagues mentioned, we're really looking for proposals here that are policy relevant, understanding that a lot of changes have happened in the Medicaid program and are going to continue to happen in the next couple of years as the One Big Beautiful Bill rolls out. I think we are open to projects that where policies are actively changing, if there can be a justification about why it's important for policymakers to understand the implications of that change in future years. And I want to encourage people applying for this to have a sensitivity in both the healthcare questions as a whole and Medicaid questions for the COVID pandemic and the effects that that had on healthcare utilization. Happy to answer questions. Thank you guys so much.
Thanks so much, Jillian. Ali Salz, over to you for online gambling.
Mind glowing. On a wildly different note, online gambling. Thanks, Shrutika. Like she said, I'm Ali Sauls. I'm on our strategic initiatives team. We work on online gambling. Our focus here is to use research and evidence to better understand how to mitigate harms of online gambling. It has become a frictionless path to betting. You can basically have a full casino in your pocket. And so at AV, we are working to both prevent new states from legalizing online betting tools until the evidence develops, given these are fairly new, and also helping states who've already legalized tighten up their gambling laws based on what we do know right now. We're also working federally to get sports betting prediction markets subject to state gambling laws. And all of this is informed by the evidence you all produce, and we depend on it to tell us what the harms and what works. We came across this work because new studies came out on online sports betting that showed us that credit scores were decreasing, bankruptcy rates were increasing, and all of this was proven causally in states that had legalized online gambling. So the research is really important. Thank you for doing it. Next slide, please. Before I jump into this, I think it's important to clarify online betting includes a lot, like online sports betting, online casinos, problem gambling, illegal offshore gambling. There's a lot here. For this RFP, we're talking specifically about iGaming, which is online casinos. And so we are looking for research to help us understand the harms of these products to individuals, households, and a comprehensive look into how this affects states, not only like revenue, but also like just the overall economic impact of legalizing something like this. In addition, how do different state regulations and platform designs impact outcomes? And lastly, how the various marketing tactics affect this. This is not a comprehensive list. This is a fairly new research subject. Online casinos have not been legal for that long. And so as long as it is the question is relevant to iGaming and policymaking, we are pretty open to it. I would also like to mention that we should be launching another online betting RFP that will be more broad. So if you were hoping to research something not directly related to online casinos, please keep an eye out. That should be coming later this year. That's all I have. Back to you, Shrutika.
Thanks so much. Really appreciate all of you sharing more about your research priorities. We'll now get into our Q&As. Oh, no, sorry, we're not there yet. Next slide, please. Okay, awesome. So before getting into the Q&A, next slide, just wanted to quickly share our timeline. And so both RFPs, again, follow a similar process where we're asking you to submit a 3-page LOI by September 11th. And then LOIs will be reviewed and full proposals will be invited in early November with the deadline for submission being January 15th. And then final award expected to be around March 31st if those move forward. Next, please. I also want to hit very quickly on a few questions we receive very frequently. So it's a VFAQ, if that makes sense. But also, for example, can you submit multiple LOIs? Yes, please submit, but separate LOI for each distinct project that has a different research question, different outcomes that it focuses on. Is there a maximum budget or period of performance? We do not have maximum budgets, but we do want the costs and projected durations to be very closely aligned with the overall scope of work. And this is something that the reviewers pay a lot of attention to. Just to provide ballpark estimates, QED studies under our building evidence RFP typically range from 100 to 300,000 and with a duration of 1 to 3 years. Again, these are guidance only, but your budget should be well justified. And then specifically designs that are eligible for funding under the Building Evidence RFP, as I mentioned before, we do prioritize designs based on natural experiments, for example, regression discontinuity, difference in differences, and instrumental variables. These are the 3 most common designs that usually move forward.